Hi, everyone. I'm UF Health's Chief Hospital Epidemiologist in our greater Gainesville market, and I'd like to take a few minutes to talk about measles. You may have been seeing news reports about cases increasing in the U.S., and here in Florida, we are also starting to see the numbers rise. So let's talk about what measles is, how it spreads, and how to protect yourself and your loved ones. Measles is caused by a virus, and it is one of the most contagious ones. It typically begins with a very high fever, as high as 105, along with cough, runny nose, and conjunctivitis or red eyes. Some patients might develop Koplik spots in the mouth, which are tiny white lesions, but that doesn't always happen. A few days later, a red, non-itchy, slightly raised rash starts on the face and spreads downwards. Importantly, people are contagious from about 4 days before the rash appears through 4 days afterward. This means that patients can spread measles before it is obvious they have it. If you see a patient with high fever and rash, especially with cough and red eyes, you need to consider measles. How do people contract measles? The virus is transmitted through the air and spreads easily. If an infected person is sitting next to someone who is not immune, there is a 90% chance that the second person will develop measles. Also, the virus remains suspended in the air and infectious for up to 2 hours after the person leaves. While most people recover fully, 1 in 5 children with measles will require hospitalization. Measles can lead to serious complications, including pneumonia, encephalitis, and rarely death. Infants, those who are pregnant, and immunocompromised patients are at particularly high risk for poor outcomes. The good news is that measles is preventable. Vaccination for measles, specifically the measles, mumps, rubella combined vaccine, or MMR, is about 97% effective after 2 doses, and immunity typically persists for life. It is a well-studied vaccine with an excellent safety profile. Children begin the 2-shot series between 12 and 15 months of age, leaving infants younger than that vulnerable to infection. For that reason, widespread vaccination not only protects individuals, but also helps safeguard the youngest members of our community, as well as those who are immunocompromised and may not mount a strong immune response. Thank you for listening and have a great day.